or will you not give the NHS the £8 billion a year by 2020 that it needs and tell us how you plan to fund it? The Liberal Democrats have. If you care about the NHS as much as you claim to, you should too.
Well, there was Nick Clegg. Let's bring in the Liberal Democrats' Norman Lamb, who's the Minister for Health, who joins us from Westminster, as you see. Norman Lamb, a very good morning to you. In terms of the cost of this idea, £3.5 billion, where will the money come from?
So we've committed, first of all, to meeting that £8 billion shortfall that Simon Stevens has identified by 2020. This is because we're all living longer, lots of people living with chronic conditions, and the numbers are growing quite rapidly. So I think everyone recognises that the costs of running the NHS will grow significantly. The Lib Dems at the moment are the only party that have committed to meeting that funding gap. But within that, we're also saying that we will make a significant extra investment in mental health, totalling £3.5 billion over the course of the next Parliament. And, you know, I think if you look at what's being proposed by the various parties in this election, there's no policy that will have a bigger impact on well-being in society, people's happiness, than making this essential investment. Mental health has been neglected for far too long. And I think that we have a real chance now to make a big difference.
Is it a growing problem? I mean, you say it's been neglected. You also point out, and we should all rejoice in the fact that longevity is increasing. But are mental health problems a growing problem?
Well, we think they may well be. We know, for example, that economic distress from the crash in 2008 probably had an impact in damaging people's mental well-being, causing more illness. Also, we think that there is an increase in prevalence of mental ill health amongst children and young people. I've secured the money to do a new, what we call prevalence survey, to identify exactly what the scale of the problem is, and that will be underway very soon. But I think the very clear thing is that people with mental ill health are in effect discriminated against in the NHS. If you suffer from suspected cancer, you will get an appointment with a specialist within 2 weeks. It's clearly set out. If you have a mental health problem, you have no such right, and you can't possibly justify that. And so for the first time ever, because of the Lib Dems in government, we're introducing waiting time standards in mental health from this week, April this year. And we plan to roll those out comprehensively across mental health so that people suffering mental ill health have the same right to access treatment on a timely basis as anyone else.
And you mentioned, the importance of getting these services through to younger people in particular. You've talked movingly before about your son's former struggles with obsessive-compulsive disorder, and part of your manifesto for the mind, is what you're calling it, is to help also mothers with postpartum depression. Who else gets the money?
Well, you've identified two critically important things. So in the budget, we secured £1.25 billion over the next Parliament for children and young people's mental health. And that can have a really, I think, revolutionary effect on access to services. And we will introduce waiting time standards in children and teenagers' mental health services. But you're absolutely right to identify young mothers. £250 million over the next Parliament for, it's called perinatal mental health. But we know that a significant number of mothers suffer from postnatal depression immediately after giving birth, and that can be an incredibly difficult period. It leads to some women literally taking their own lives, and for many others they struggle for sometimes quite a long period with mental ill health. And yet we know that if you can get access to effective treatment, you can have a big impact on improving that individual's well-being. So that investment is an essential investment, in my view. The moral and the economic case for doing this is overwhelming. And we know that if you invest in mental health services, you get a return on your investment. People use services less in later years.
And most people would agree it's all, a very laudable ambition. And perhaps some people object to the idea of us looking crudely at this from a sort of base political standpoint. But does it have any traction, mental health, on the doorsteps? Is it an issue that people are keen to talk about as you knock, door to door on the campaign trail?
It's fascinating. There was a moment a year or so ago when somebody outside the party said to me, "Well, Norman, you're doing the right thing, but there's no votes in it." Actually, I think people care passionately about this, and the evidence that we've had is that it's incredibly important to people, and that people strongly support it. It's interesting with mental health. People don't yet often feel able to talk openly about it. That's one of the things that we're seeking to challenge, the stigma of mental health. But it doesn't mean they don't care about it. And I think that this really strikes a chord with many people, including many young people who are too often turned off the political process.
Norman Lamb, can we just talk about one other topic? Inevitably the election campaign throws up other subjects other than the ones that you're booked to talk about necessarily, but there's some talk in the newspapers and elsewhere today. Inevitably it's got to come up in the campaign. The question of leadership post Nick Clegg, should that arise. Tim Farron describes by some people as a figure who divides as much as he unites, described by Vince Cable and others as perhaps somebody who's focusing a bit too much on his own ambitions. Can you offer us any perspectives on who comes after Mr. Clegg?
Well, look, I was Tim's mentor when he first arrived in Parliament. I arrived here 4 years before him, and it was my job as an existing MP to teach him the ropes, to tell him how to best hold your seat, to how best provide a really good service to constituents. We therefore had a lot of contact during that period, and indeed since. And I was up in Westmoreland 2 or 3 weeks ago supporting Tim's campaign there. So my view is we should all, in a very disciplined way, focus on making the case for why people should vote for the Lib Dems. Our central message, let me just make this point, our central message of trying to build a fairer society but also a stronger economy. No false choice between deep cuts on the one hand with the Conservatives and too much borrowing on the Labour side. A balanced approach which achieves both the strong economy and a fairer society. That's what I will be doing. And the job I'm passionate about is the job of being Minister in the Department of Health, fighting for equality for mental health services.
You've seen him at close quarters, though. Would Mr. Farron make a good leader?
No, I'm just not going to comment on any of that. He's a very good colleague. He's a very talented colleague, and I've got a lot of time for him.
Norman Lamb, appreciate your time. Thanks very much indeed.
In the last few minutes, the Russian